I love this comment that Angel just put in. What don't CHWs do? Because honestly, when I'm thinking about it, as I was listening, I'm like, oh my goodness. I literally I stopped at 8. I could have kept going on and on and on, but I was like, okay, I think they get the point at this time. All right. So the last thing we talked about on that last slide was reimbursement, right? Saving healthcare dollars, making money. This is the thing about business. Trust me, I'm in business. I've been in business 5 years. If you got somebody that can save you money and make you money, you've got a great employee, hopefully. So let's talk about how CHWs can certainly make you money. Now, I'm going to give you a disclaimer. We have an awesome new consultant that's working with us. She is a subject matter expert when it comes to CHW billing and reimbursement. She has built a successful care management agency using community health workers, and she had a professional emergency come up on yesterday. And she was supposed to be here to deliver this information. But what I'm going to do is I'm going to take her slides and I'm going to do my very best to speak on CHW integration, CHW credentialing for reimbursement. So traditionally, CHWs have not been considered healthcare providers under CMS definitions. However, as Tasha alluded to earlier, some states and payers are expanding the role of CHWs to allow reimbursement through Medicaid and other programs. And so when that happens, there's a few things that you need to do to position your business to be able to bill or reimburse for CHW services. And there's kind of a 5-step process that we've put together here at Umemba Health, and I'm going to go over these 5 steps. Starting with MPI education and training. So anything that I share with you, of course, it's something that should be added to your checklist. Give us a moment. We actually will create a checklist for you, but have not yet. But it's also something that we can assist you in your organization with as well. And so as we've talked about integrating specifically a lot about the healthcare today, this is something that we feel is kind of the missing piece for organizations when it comes to integrating CHWs, and certainly going to be added to our 6th right, which is the right funding. So first is MPI education and training. That's the first step to getting credentialed for reimbursement. If you did not know, an MPI stands for National Provider Identifier. It is a unique 10-digit number that is issued by CMS, the Centers for Medicare and Medicaid Services, to both healthcare providers and organizations. And it is used for billing, for credentialing, and for administrative transactions in healthcare settings. Now, some of the reasons that CHWs will need an MPI include, of course, billing for Medicaid, billing for MCOs, managed care organizations, and also insurance payers or insurance plans. Having that MPI will enable CHWs to be recognized as providers under those billing systems. And then also for facilitating integration into the EMR, the electronic medical record. Also care managed or care coordination platforms as well, because I know some, like health departments, when I worked at the health department, we didn't necessarily have an EMR, but we had a care coordination or care management software. So having that MPI number will help the organization track their CHW provided services in patient records. Here are some key considerations to think about as you are thinking about whether or not this is right for your organization. State and payer policies do vary, so not all states reimburse CHWs directly. You'll have to check with your Medicaid policies and with your organizational policies. There are certain requirements that are required from your employer and organization that may be different. So some CHWs may need their own MPI under the direction of the employer. And then sometimes billing supervision is something that you have to consider. So even with an MPI, CHWs may still need to, depending on the setting, bill under a supervising provider. So that can be a nurse practitioner, physician, or some kind of other licensing provider like a social worker, which is what our consultant is. Okay, so step 1 is MPI education and training. This is where you're going to provide an overview for your employers, for your employees, your CHWs, as well as the leadership in your organization. What we do is we can help you explain what an MPI is, what it's needed, and how it benefits your organization, and also provide an overview of your state-specific Medicaid and payer policies for CHW reimbursement. We also work with a billing company that helps provide assistance and advice on understanding your CHW billing and reimbursement, and also helping to clarify those supervisory requirements. So like I said, sometimes there's billing that's called, I think it's called incident to. It's been a long time since I've been clinical, but incident to billing. And so if that's required, we can provide supervisory TA on that as well. You also need to consider compliance and documentation training. So, when you're billing and trying to get reimbursed for services, there's certain ways that you have to document. Nurses are familiar with this, providers are familiar with this, but CHWs, this may be something that's completely new to them. So that certainly has to be covered as well. And then discussions on how to align the CHW work with coordination of care, with the health information exchange, and with electronic medical records as well. So all of those things you need to think about when it comes to step one, which is NPI education and training. Secondly is the application and enrollment assistance. Again, this is certainly something that we can help with as well. We can do this individual, because I've already talked to a couple of individuals, CHWs, that are looking to start their own care coordination services or work for a care coordination agency. And this looks like walking the CHW or the organizational leadership through the NPPES website. That stands for National Plan and Provider Enumeration System. Ensuring all of the necessary information is collected and submitted correctly. You've got to identify the correct taxonomy codes for the state, for that particular state. This also looks like enrolling in Medicaid or payer enrollment. So again, different insurances require different things. The MCO may require something different, et cetera. And also guiding the organization on whether CHW should apply as individuals or be registered under the organization's NPI. The third step, and the third and fourth, we actually do this in consultation with our external billing consultant. So the services here include CHW service mapping for reimbursement. So essentially, this is identifying what CHW services can be billed under Medicaid, MCOs, or private payers. Developing a framework for those supervised billing models where you do have to bill under a provider. Again, that coding and documentation guidance and integration with EMR. So advising on how CHWs can be integrated into the clinical workflow, my personal favorite thing to do, and documentation in EMR settings. And then also ensuring that CHW contributions to patient care are adequately captured for billing and reporting, because CHWs, like Angel said, what don't they do? They do a lot of stuff, but are you adequately capturing what they're doing and how they're providing care for patients so that you can get reimbursed for those services? The fourth step is policy and compliance. The first step there includes an employer readiness assessment where we evaluate whether your organization is actually prepared to integrate your CHWs into reimbursement systems. We'll recommend staffing, training, workflow changes, et cetera, to optimize your processes. Our external billing consultant will conduct state and policy federal reviews. And so that's researching and interpreting Medicaid, CMS, and state specific policies regarding CHW reimbursement. This step also includes some data and reporting requirements. So assisting with tracking systems that monitor CHW services, patient outcomes, and reimbursement success rates. And like any good consulting services, of course, you want to provide ongoing technical assistance and support. And so this can include things like keeping the organization informed about policy changes, new billing codes, and reimbursement opportunities. Of course, we are a training organization, so we would love to provide quarterly, biannual, or annual training refreshers for CHWs and for your leadership teams as well. And then also implementing some QI or quality improvement processes here, helping you evaluate the impact of your CHWs on patient outcomes and cost savings, and then recommending some strategies to enhance your reimbursement strategies for sustainability. Now, again, if Lakeitria is here, she would be able to share with you how she integrates CHWs into her care management agencies and what that looks like. Unfortunately, she wasn't able to. But if you have any questions about our services or just the steps that you need to get started, please don't hesitate to reach out to us. And I'm going to make this a lot easier for you because we're going to put in the link for you, or in the chat rather, a link for you to complete a survey. So help us help you as we vet our new CHW credentialing services that we think so many organizations can benefit from. We'd love to get your feedback on what you need the most help with. So if you scan the QR code or you click the link that's coming through the chat right now, thank you, Tasha, go ahead and complete this short survey. It should not take you but 2 to 3 minutes. So again, scan the code or click the link in the chat.